Hi, I'm Paul Ryan, Representative of Congress from Janesville, Wisconsin. I'd like to talk about what happens in healthcare today if the government plan that is pushed through Congress actually becomes law. Here in the House of Representatives, the three main committees are pushing a legislation that would create a new public plan option. The President is fond of saying, if you like what you've got, you can keep it. We need this public plan to keep health insurance companies honest, to give people more choice and competition. The problem is, the substance does not meet that rhetoric. And what we see when we unveil the details of this bill is not only does this new health care plan involve $1 to $2 trillion of more taxes and more spending, what it does is it sets up a system where the government sets up a public plan option which competes against the private sector. It's a stacked deck. There's no possible way the private sector can actually compete with the public plan. Number one, the private sector has to pay taxes. The public plan doesn't. Number two, the private sector actually has to pay for their payroll and their benefits of their employees. The public plan doesn't have to account for that. The private sector has to set aside reserves. The public plan doesn't have to do that. The private sector has to pay taxes. The public plan doesn't have to do that. And so when you actually look at what the difference here is the public plan is both the referee and the player in the same game. It's kind of like my daughter's lemonade stand competing against McDonald's. It is not a fair competition. And that's why actuary after actuary, expert after expert is coming to Congress and telling us a public plan option quickly becomes a government-run monopoly. The Lewin Group, one of the most foremost actuarial firms of America, is telling us a plan like this could lead to as many as 120 million Americans in 3 or 4 years losing their health insurance. Just this morning, another group called HSI Network, a reputable actuarial healthcare firm, is saying that the plan moving through the House of Representatives not only costs more than $3.5 trillion in new spending, 64 million Americans will actually lose their health insurance. And the way it works is this. If a person offering health insurance to his or her employees, an employer, finds that their costs are going up and up and up, as they would under a public plan option, they have to make a choice. Keep paying these extraordinarily high prices or put my employees in the public plan option. And what the actuaries tell us is most employers will make that decision and they pay an 8% payroll tax. So the real consequence, the result of this idea of the President and Congress's public plan option is to have this public plan option unfairly compete with the private sector and eventually become a government-run monopoly with an 8% payroll tax, meaning the payroll tax in America on all workers becomes 23%. This is not what we want to achieve in America. This is not how you grow jobs. This is not how Americans stay competitive. This is not how we keep good jobs in our country. And more to the point, the only way to reduce costs under a public plan option system, under a system where the government takes more and more control of our health care, is for the government to ration care. We have seen how this works in many other countries. We have seen the long waiting lists in Canada and Britain. We have seen how people who want and need help, like artificial hips, bypass surgeries, are on waiting lists or are denied that kind of a care. We don't want a system where we put government bureaucrats in the middle of decision-making between patients and doctors. We want a system where patients and their doctors make the decisions. You see, we can have universal access to affordable health insurance in America for everybody, regardless of pre-existing condition, without the government taking it over, without new taxes and new spending. We already spend more than 2.5 times per person on health insurance in America than any other country. We just need to spend that money more efficiently and more effectively. And I've introduced legislation called the Patient's Choice Act, which shows exactly how this can be done. Under the Patient's Choice Act, we have universal access to affordable health insurance that's private. Individuals have more choice. The patient and the doctor are the decision makers in our healthcare system, not the government. And we don't impose new taxes and all this new spending. I invite you to take a look at this alternative, a real alternative to this government-run takeover of our healthcare sector. Please go to my website at www.house.gov/Ryan and click on the part for PCA, the Patient's Choice Act. Thank you very much.